Welcome, Dr. Wrik Laha, to this interview. So, thanks, first of all, thanks for accepting this interview on behalf of the Marrow team. And second thing is, very many congratulations. There are now a
Thank
lot of aspirants who are now looking up to you to see what you have to tell them. So, I think they don't want to hear me, they would want to hear more from you in this next half an hour. So, first of all, please tell us your background. Where are you from? Where did you did your MBBS? You had been where did you do your post graduation? Whether you were practicing or you were directly preparing for the super specialty interest. So let us know a few things about you.
you, ma'am. Good evening. I am Dr. Rick, and I am from Kolkata. I did my UG. I passed out in 2020 from Neil Ratan Sarkar Medical College, Kolkata, and then subsequently I joined PGI Chandigarh in 2021 for my post graduations, and I passed out in 2023 November, and and after that I had got a DM seat last time. Uh, I got DM Neonatology last time as well, but I wanted to uh, see whether I really wanted to pursue neonatology or not. So this time I gave the exam again, and I've got through this time and got a rank 4 this time. Yes, ma'am.
Yeah, that's nice. I didn't know that you were a PGA alumni. So I have a friend over here. And as I told you, we are decades apart, but we are droplets in the same ocean. Now, it is a very good point that you conveyed. Like you took some time to decide whether you actually wanted to do neonatology. A lot of people are now going in a stream that after PJ, I have to do something immediately, otherwise the chance will be lost. And they are picking up things where they are not sure whether they are going to enjoy it. I like that about you, that you took your time, decided, though there is an ambiguity whether you'll get the seat again, you decided to go ahead with it. Now, what the aspirants would want to know is the first thing when you say that you're from a central institute, there is actually a thought in the mind, oh, he's from the central institute. So you would have learned everything there. Questions are picked up only from there. So I would want to know in the entrance examination, how much of the pool was what you read from textbook and the guidelines, and how much was what was taught in the classrooms or during your rounds or what you learned from your postgraduate training. Can you share that with us?
Yes, ma'am. I would say, as we all know, that PJ Chandigarh has a really big neonatology department. Like it has almost 6 divisions and has a huge workflow. But however, I think that in with as good as it is in patient care, because we are always running behind our patients, sometimes academics takes a backseat when we are actually there in our newborn postings there. But however, the passive learning that we always do during our ward rounds, during the what the consultant teaches us, during the morning sitting rounds. So I would say regarding the AIMS pattern exam that the INI SS is conducted by AIMS. So one can expect that most of the questions will be based on the AIMS protocol. So if one has gone through the AIMS protocol well, I think they can expect to score really good marks in the exam. However, there are a few practical things which are always asked in INIs, which can only be answered if you have done your postings well. For example, this time, for example, in the book, there is no pictures given based on. Uh, there's grades of IVH are written, but however, it is not written. It is not shown in pictures in the book that how it actually looks like grade 1, grade 2, grade 3, and grade 4, how it actually looks on an ultrasound machine. So this time there was a question, and they were asked to identify the grade of IVH. So these are few questions which you can only answer if you have actually gone ahead and, well, it's not that you have to do the ultrasound, but if you have at least seen your SRs do it, or your consultants have shown you in your rounds or during your ward rounds that, okay, this is a grade 2 IVH, or this is a grade 1 IVH, this is a grade 3 IVH. Also, there was one question on OAE, which is autoacoustic emissions. So we had a lab in PJ where all this OAE and AAPR is carried out. So if you have visited the labs, then you would know that, okay, this is how the procedure is carried out, and this is how the graph looks, or this is how the pass and the refer thing comes up. So these are few practical things, I think, which really helps. Matlab, it gives you an edge being from Central Institute, I think, because I don't think all these things are available everywhere, but however, it's available in most of the centers nowadays, because neurology department, I feel, is developed in most pediatric centers nowadays. Matlab, even PICU and NICU are two things I think almost all government medical colleges have, uh, and they're quite developed. So, but however, one thing we have to always keep in mind is that uh, in PGI we follow a different kind of a different protocol. We have our own protocol, and the AIMS protocol is a tad bit different regarding few topics. But for the INI exam, you have to follow what is written in AIMS protocol. Like you have to know the protocol, the three volume of the protocol that the 2024 edition, 2023 in November, I think it was launched, in the new AIMS protocol third edition. So it is very important and very prudent to go through the entire thing by heart, I would say. And obviously your training helps, because when you have trained and you have worked everything, now when you finally go through all of them, then you actually know that okay, so these are the things I have done, and this is the basis on which I have done all this. Like during the working phase, you are just sometimes it, due to the rush of the patient or something, sometimes it is like you're just following instructions of your seniors ki ye karna hai, ye karna hai, that you have to ye wala chart kar do, wo chart kar do. But why you are doing it, what should be done, what is ideal, that is what is written in the book. So sometimes I would say that during our exams, because we hardly get any leave to read prior to the exams, so sometimes we specifically pick out chapters and read for our exams and go, because we know that theory exams questions will come from there itself. However, in case of practical exams, in case of the INI exam, you have to know all the things, all the chapters, even the minute, small chapters, which we often do not read during our MD days. So even those chapters have to be read. So the prudent approach is to have a very thorough reading of all the three protocols, and your training will obviously come and help you during your exams, because sometimes some questions you might have forgotten, but it will suddenly strike your mind that okay, I had done this for some patient, and patient are the best teachers, obviously. Yeah, that would be my viewpoint regarding this.
So I would agree with you on that point. We were always told that energy can neither be created nor be destroyed. So if you are putting so much energy either into learning or in your clinical work also, it will come back to you as a reward in some other way. Be it this exam or some exam, people would have realized that what they practiced in MBBS have helped them in the super specialty exams also. But coming to the theoretical part of it, we would want to know, in short, what are the reading material that you followed? You told us that you were thoroughly reading the AIMS Neonatology Protocol. So those are three books, and it is actually the most simplified version of neonatology which is given. You have to. It is so easy to understand and it is so clear. But apart from that, what other written material that you would want the future aspirants to read thoroughly? What
Um,
helped you?
yes, ma'am. Ma'am, I had read the three protocols, but if one starts reading the AIMS protocol, they would notice that in few places the concept behind that is not given. Like, why is it like this? Like, for example, we are choosing a certain antibiotic. Why are we choosing that antibiotic? Or like, for example, uh, regarding for example PVL, like why does PVL happen here only, not why does not it happen elsewhere? So regarding the concept part, I think Cloharty is a good book to follow. I have personally read bits and parts of Cloharty just to add to my knowledge, apart from the AIMS protocol, because I did not have much time to prepare. I prepared for 2 months, around 2.5 months. So I read the new Cloharty and Stark, the new Southeast Asian edition that has come out recently in 2024. So that one I had read in bits and parts just to supplement my knowledge and to gain a better depth and understanding of the topics that are already given in AIMS protocol. And I think if you have read AIMS protocol really well, then Cloharty would not take much time. If you flip through the pages, you would know that what is given extra in there, and you can pick up the concepts about why is it being done, or why has such protocol been created. Like for example, any drug protocol, or for example any fluid protocol, why it was created such way. in such a way. Why 60, 80, 100, and 120? Why 80, 100, 120, 140? So those concepts I think are written a bit like elucidated in a bit better way in Kloati and Stark. And also regarding the ultrasound images and regarding few things like difficult intubation, which are few topics I think which INI asks, like in cases of difficult airway, what are the steps to be followed, and the eco views, for example, in case of various. There is a chapter in Kloati as well, uh, which shows all the point of care ultrasound images. It's given there. So these are a few things I would suggest that we can go through. I think Kloati is a really good supplementary material to the AIMS protocol. However, our my main source of information for the entire exam was AIMS protocol, I would say. And I had read it at least, I think, 3-4 times prior to appearing for the exam. And Kloati, I had supplemented Kloati, and I had written inside my AIMS protocol and only whatever I wanted to add extra. And the images part I had saved in my iPad, like the images that I wanted to see prior to my exams, those things.
How much do you think that going through recent articles, guidelines, apart from the AIMS guidelines, because IAP also keeps publishing guidelines. There is Ministry of Health and Family Welfare who keeps releasing. Do you think that questions will be taken from them? Do you think it is very important that people go back and read it, or at least for the entrance part of it, we don't have to touch it?
Ma'am, this time I think many questions were from the NNF guidelines. Uh, the recent NNF guidelines. There were, at least I can recall right now, at least 4 questions were there from the recent NNF guidelines. So even in the last exam, there were 2 questions from the NNF guidelines, but I have not seen a single question from the IP guidelines or the Ministry of Health and Family Welfare guidelines. But not that not can I, something I can recall right now. So I think the NNF guidelines would be a good supplementary to the AIMS protocol. However, in the AIMS protocol itself, the AIMS protocol is an amalgamation of all the protocols that have been going. Yeah. So, like NNF guidelines, it is given there inside the AIMS protocol as well. But however, if somebody wants to read something extra, I think it's very prudent to go through the NNF guidelines. And also for the nutrition part, I think the SPAGAN guidelines are important, because the SPAGAN preterm nutrition guidelines 2022 2023, those guidelines were tested before. And the recent guidelines, we have to keep a track if anything recent is coming through, because as we know, even during our postgraduate examinations in INI-CET, even then AIMS used to always test us. 1 or 2 questions will be there on the recent guidelines or recent things that has come out. So I think that is important. One more thing I would like to say is that one should read the recent NFHS 5 guide, the data. Last time there was a question on the NFSH 5
Statistics, yeah.
yeah, now it is the 6th one is going on, but last time there was a question on the 5th exclusive breastfeeding rates. So one statistic based question, like one percentage based question, we can always expect. It has been tested before also, like regarding, for example, the percentage based question, in the sense the Cochrane 2022 review regarding the surfactant administration, that the percentage reduction in the neonatal mortality, perinatal death, then the 15 those percentages, those are few things I think those can be asked and are asked. Last time there was a question, I think, for the upcoming examination, the NFSH 6 data would be applicable when it would be completed, because that would be coming new in the next year. So those are few things I think is required. But however, there were not many questions on the new, like absolutely new guidelines. I don't think that there were many questions this time. However, only if one guideline can be read, it is the NNF guidelines. Yes, ma'am.
That's actually pretty good information that you have given us. Another thing I wanted to statistics based question. And how did you prepare for such questions?
Statistic based, ma'am, in the sense
Basically,
biostatistics.
sample size, number required, which is the most ideal type of test to be done.
Yes,
Did we
ma'am.
get such questions in both the exams that you have? Yeah.
Ma'am, this time the statistic questions were straightforward. in the sense it was not statistic numerical based questions, but last time there were questions on graph interpretation and also on confidence intervals. This time the
Okay.
questions were pretty straightforward, in the sense like consort guidelines is used for what, which thing, which is for RCTs, and like fishbone analysis is used for what, or there was one question on I think on systematic reviews as well. Forest plot is used for what. So meta-analysis and systemic review. So they were straightforward questions this time. However, last time there were questions on confidence interval, taking out p-values, and also there was one question on interpretation of graphs. And in fact, in the interview as well, there was one question on on statistics. So regarding the preparation for statistics, I had done my preparation from YouTube, ma'am. In the sense, um,
Okay.
because yeah, in the last time actually I had not prepared statistics and on, because it was prior to my exams, 1 month prior to my MD finals. So I had not been able to attempt any of the statistics question last time, because I was not really like confident, or like I had read all that that time. But this time I had, because last time I had faced problems in that I had not been able to attempt the statistic question. This time I had made it a point that I would because there will be at least 4 to 5 questions on statistics, on biostatistics. Um,
Yeah.
it will always be there, and so this time also it was there. But however, they were not numerical based this time. It was straightforward questions. Yes.
Okay. You already answered. I wanted to ask you a reference to how do you remember your statistical answers and everything. Because those are very volatile material, right? When we are doing actual research, you go back, check your formula, and come, or there are softwares which help you. But there, when you have supposed to calculate the sample size, you get totally confused. So, sometime later, you can share all your any links that you followed which you found helpful. And people now, I wanted to get your feedback on your online platform, Marrow, how
Mm.
much it helped you, and which part of Marrow was totally beneficial, and would want you to suggest to the users how they can use these online platforms.
I solved a few MCQs, which I found really helpful, because I don't think any other platform has this kind of MCQs and this kind of good explanations given. Just like for the Marrow PG app, Postgrad app, and like the SS app is coming up to it. I think it is still in the development phase, but it is coming up to it, and the content is really good. And regarding the exam, I gave 2 tests there just prior to my exams. The INISS mock, there were 2 mocks. So those were the 2 mocks that I gave, and I found it really helpful. Regarding using any online platform, I would suggest, regarding neonatology, AIMS protocol is your first source. Secondly, you can supplement your knowledge from the online platforms. And regarding the general pediatrics part, I feel that online platforms may be of help. But personally, I had not used. I had already my notes were already made from MDs, so I had used my own notes that I had prepared from Nelson and Ghai, uh, and the STGs, IAP STGs. These are like the recent online offerings by IAP that is easily downloadable on the internet. You just got to type in Google the topic and write IAP STG, and you will get a PDF which has been compiled by one of the good professors from all over the country. And I think that is a very concise and crisp material which can be used for preparation purposes, and also for your MD exams or for writing your answers. I think it is a very nice material, and it is updated, like it has the recent guidelines. Obviously, Nelson is our Bible, but Nelson sometimes is very extensive, and even the language can get a bit tricky. But however, if we keep reading Nelson bit by bit, I think it gets to you. I think you start grasping the topics well, and you start grasping the concepts one by one. But however, I think that Ghai is one book which should be read even in MDs, even like during our exams also. Ghai, all the topics of Ghai had to be read, because any question could come from Ghai. Like if it is mentioned in Ghai, it can come. Maybe the topic won't be as elucidated, as elaborate as in Nelson, but however the topic, but at least you can write something in the exam. This is regarding the MD professionals I'm saying, not for INISS. But however, there are few chapters in Ghai which should be read for INI. For example, first is development, growth and development. That chapter should be read from Ghai. IEMs should be read from Ghai. And and poisonings should be read from Ghai. So these are three things I would suggest that everybody should read from Ghai for the INA exam as well.
Okay, so for the SS entrance also, you would want them to read some topics in card.
Yes.
That's great. Okay. Nowadays, we find aspirants who take a break, like they do their PG, they work or they not work for a few days, but they then take a sabbatical for almost 6 months, 12 months, and they say that we are going to prepare for INASS, we are going to give a super specialty exam. So I wouldn't say that this is your advice or suggestion, but I would ask your opinion. Which works well, like you be in the field, you work and you give an entrance exam, because once you have done your MD and you're already working, you know most of this stuff. It is not like a totally new field. Or what did you feel, because you have given entrance both times, or taking a sabbatical and indulging yourself in the theory part of it actually helps? I just asking for your idea or opinion.
So, ma'am, I think regarding this, I would say it ultimately boils down to your personal preference. In the sense, I really feel that after JRship is over, I think you should work and see that whether you actually like what is the subject you want to work in, and also develop your skills in what we have already learned. And also SRship is important in the sense that we learn man management skills, we learn equipment management skills, and we learn other things like administration. So these are three things that we learn in SRship as well, in general SRship. So generalist, whether you want to do general SRship or not, it ultimately it's your idea of it. In a sense, my friend from my batchmate from PGI, so he has been working in PGI for the last 6 months, and he has got a rank 2 this time in PGI neonatology only. He's my friend. So it does not matter that whether you are taking a break and reading or you are reading while working. So in the sense, if you are really motivated enough, काम करते करते भी आप पढ़ लोगे, ऐसा कुछ नहीं है. But if you think that you cannot manage both things together, then it's, and if you're really fixated on the idea ki I want to do uh, DM in such and such subject, I know that this is what I want, then you can, I think, take a break and then you can go forward with it. Yeah. As for me, I had not worked for the last 2.5 months. I had left my seat and come back to home, and I read for 2.5 months. Yeah, but if given the opportunity, I think that I would have continued working as a journalist. But however, there were no openings at that time. So yeah.
Okay. Okay, that's great. Anything else you want to share with us, Dr. Rick?
Um, Ma'am, I think it's very important to realize that uh, DM, although DM is coming in a big way in pediatrics, I'm sorry, there is this fly. Uh, although DM is coming up in a big way in pediatrics, I think it's very important to grasp your general pediatric concepts really well prior to going forward with a DM doctorate, DM in a specific subject, because when we pass out of our DM and we go into the professional life, it's not like we won't be seeing other patients. We'll be seeing other patients as well, and the neonates who will be growing up, they will not leave you, they will come back to us only. So I think it's very important to grasp your general pediatric concepts really well. And one more thing is that maybe neonatology does not cater to all the bigger children. Usually they would come to follow up till 5 years in most of the high risk clinics. However, in other subjects, other DM related subjects, I think if you have a really good grasp over your general pediatrics, then it helps you stay unbiased towards your subject, and you can see the patient as not a patient of maybe nephrology or rheumatology or neurology, or as a patient of pediatrics. And then I think it really helps. So it's very important to first decide on whether you want or to grasp your general pediatric concept well, and then you decide that okay, I want to do in this, and then take the leap. That is very important. I had always felt that I am very comfortable doing neonatology, and that is the reason. But still, I wanted to take a break for 6 months and decide on my own that whether I actually want to do this or not. And yeah, that is the reason I took a break of 6 months, and then I gave the exam. So,
The fly knows that you're very sweet.
thank you.
And welcome, Dr. Wrik Laha, to the field of neonatology. So, in another 3 years, we are going to be colleagues, and we all have that Om Shanti Om Sharakan moment. So, when I get the seat, I'm going to throw this dialogue at everybody. So, it was great having you here. It was great meeting, knowing you as a person. So, all the best for your career.
Thank you, ma'am. Thank you so much. Thank you for having me.